let me introduce you to the drug that is most familiar to each and everyone. But only familiarity is not enough to take this drug. Let's dig into it. Aspirin has been used in the United States for more than a century and remains one of the most commonly purchased over-the-counter medications. Because of its long history and easy availability, it is often perceived as harmless. According to the U.S. Food and Drug Administration, FDA, aspirin is classified as a non-steroidal anti-inflammatory drug, NSAID, and has systemic effects beyond pain relief. Aspirin affects platelet function, gastric protection, and inflammatory pathways throughout the body. Because of these widespread effects, improper or unnecessary use can increase the risk of harm, as documented in clinical literature indexed by the National Library of Medicine. Let me talk about few wrong use of aspirin, something that is beyond the pain relief. Using aspirin without a clear medical reason. Aspirin is frequently taken without a clear medical indication, including habitual use for minor aches or general prevention. FDA drug facts labeling states that aspirin should be used only as directed and for the shortest duration necessary. Clinical reviews indexed by the National Library of Medicine show that chronic or unnecessary aspirin use increases the risk of gastrointestinal bleeding and other hemorrhagic complications, even when doses remain within labeled limits. Because symptoms may not appear immediately, people often continue using them without realizing that injury may be accumulating over time. The next one is something that people totally ignore is the bleeding risk many people don't notice. Aspirin irreversibly inhibits platelet aggregation, meaning it interferes with the body's normal blood clotting process, as described in pharmacologic data from the National Institutes of Health. This antiplatelet effect increases the risk of gastrointestinal bleeding and, in some cases, intracranial bleeding. Studies published in U.S. medical journals, including the American Journal of Medicine, have documented this risk, particularly in older adults and individuals with additional risk factors. Because internal bleeding may not produce early warning signs, serious complications can develop before symptoms become noticeable. So one must think twice about using aspirin, and this has a risk of bleeding as well. Next one is what aspirin does to the stomach. Aspirin reduces protective prostaglandins in the stomach lining, increasing susceptibility to gastritis and peptic ulcer disease, according to gastroenterology data indexed by the National Library of Medicine. Taking aspirin with food may reduce stomach irritation, but it does not eliminate the risk of mucosal injury or bleeding. Repeated exposure over time, even without obvious discomfort, can result in clinically significant gastrointestinal damage. The next one is really common, and no one even notices it. Combining aspirin with other painkillers. Using aspirin together with other NSAIDs, such as ibuprofen or naproxen, significantly increases the risk of bleeding and kidney injury, as warned by the FDA. Drug interaction analyses from the National Library of Medicine show that combining NSAIDs increases toxicity without providing proportional pain relief benefits. Over-the-counter availability does not mean these medications are safe to combine without guidance. Aspirin and heart protection. What changed routine aspirin use for primary prevention of cardiovascular disease is no longer recommended for most adults. Large clinical trials published in major American cardiology journals demonstrate that in people without established cardiovascular disease, the risk of bleeding often outweighs potential benefit. Current U.S. clinical guidelines emphasize individualized risk assessment and physician guidance, rather than routine aspirin use for prevention. Now it's important to know that what's the right way of using aspirin. When used appropriately, aspirin can provide effective pain relief and important therapeutic benefits for certain conditions. Proper use includes following labeled dosing limits, avoiding unnecessary combinations, and understanding individual bleeding risk, principles emphasized in FDA labeling and NIH-supported clinical guidance. Aspirin is not inherently dangerous, but misuse turns a well-studied medication into a preventable source of harm. If you like this video and want to discover more about drugs usage, watch my another video on acetaminophen. Thanks for watching.